Welcome back to the Friday blog. Goodness me, it's a warm one. You might end up seeing me in shorts at some point as we go through the summer. I'm not sure that's an inducement to tune in, is it? You won't see me in shorts at the annual members meeting, which was the first thing I wanted to talk about this week, because you've got one more Saturday left before our fun day over in the park in the centre of Scunthorpe. You don't need to come for the whole day. Come for an hour, come get the free ice cream, come throw water at Dr. G. Graham and myself, pay a fiver and do some abseiling or take part in some of the games, or just bring your mates, bring your friends. We've been advertising this for a little while. We had such a successful one last year in Rotherham. Let's see if we can keep up that track record this year in North Links. We do have a think about where you, your family, your friends, your work colleagues want to be there. I am told there are still a couple of spaces for either quick cricket teams, which require 8 players or less, or the It's a Knockout contest. I'm also told that last year's ringers, who I believe were local firemen, will not be allowed to compete this year. But you've got to be in it to win it. So get in touch with Joe Madonna and the comms team if you want to be a late entrant in those contests. Remember, why do we do something like the Fun Day? Well, it is part of us being at the very heart of our communities. We're going to see different people at those events than perhaps we see at some other things. And that couldn't be more resonant of the kind of neighbourhood health service that you're going to perhaps tire of hearing senior leaders in the NHS talk about as we go through the summer. Before I get to that, I want to say a massive shout out to everybody who works in our children's care group, in children and young people's services, for their work to make sure that children and young people are at the very heart of this year's annual reporting cycle, the annual members meeting and the Fun Day, in addition to a focus on child and adolescent mental health services at the formal annual members meeting. There is also a dedicated child and young persons challenge the board event that we are running in the middle of the day. I must say, I'm really looking forward to that opportunity. So thanking to Rhoda and to others for the work to put that into place. Now, I've alluded to the fact that the government has published the 10-year plan for the health service, and you may or may not have had a chance to glance through it. And there are all sorts of takes from different professional associations that either lean in with support or criticise the things that are missing from it. I've said before, we will organise some online briefings as we go through the summer months to give people a chance to talk about it and make sense of it together. But there were 3 or 4 things in there that caught my eye that I thought might be worth highlighting here. So you will see a real emphasis on trying to make sure that there are joined up multi-professional or inter-professional teams working on a neighbourhood basis. I hear 2 dialogues when I talk about that. One is, well, we've already got that. We've been doing it for years. And the other is, well, we haven't got that, but we've tried it loads of times and it'll never work. Clearly both can't be entirely true. But for me, what I'd suggest to you will be important is to make sure that the neighbourhoods that we're talking about in that narrative are meaningful to people who live locally. Love locally as well, by all means, but particularly live locally. Rather than being, if you like, a one-off building or a one-off hub that is created. Much as we need our symbols, the more important transition for health services over the next little while is to become genuinely person-shaped at a local level. So the work we'll be doing with council partners in each of the 3 geographies that we work will be to try and make sure that the transition to creating a local version of a neighbourhood health service genuinely joins up processes of care, removes duplication, and adds value to perhaps the most vulnerable and complex patients that we work with, as opposed to just moving stuff about in the way the NHS does every few years. What we also see in the plan is a shift, which is described as from bricks to clicks, putting the NHS app at the centre of communication, but also seeing the potential of machine learning and AI to really help us to solve problems in the way in which we administer and the way in which we provide care. Now, once again, there are two schools of thought: the digital enthusiasm that one will have, and the sense that if it takes this many clicks to register something on one of our systems, or this many minutes to get my computer to come on and stay on, then it's a little bit of a pipe dream to think about those possibilities. I think, again, both are, in this case, plausibly true, aren't they? We do need to be at the leading edge of what is possible in terms of technology. There's no reason that the communities that we work in, that are some of the most excluded and challenged communities anywhere in the country, should be denied the opportunities of technology. And we have some brilliant pilots and projects in the Trust already that speak to that. And at the same time, we have to get the basics right. And I know that Lee and Nigel and other colleagues in IT are working really hard to make sure that our core technology is effective and works wherever you're working. However mobile your job is, you really shouldn't need to come back to base just to log in or to load up technology. You may need to be back in base to talk to your colleagues. So we've got a transition path to make. As a board, we spent quite a lot of the last Thursday of June working that through with external advice to think about how we really begin to create a more digital Ardèche. And then, of course, there's the shift from treatment to prevention. So easy to say, so easy, I guess, to conceptualize with the brilliant work we're trying to do around using vapes, for example, to help people to step away from tobacco. But at the same time, sometimes the NHS moves to prevention by setting up a new NHS service, rather than thinking about the kind of projects we've got involved in recently, where we're investing directly into schools, we're creating housing projects, we're really trying to make a left shift that's less about the NHS moving and more about that focus on health. I could do the whole of the vlog devoted to a 10-year plan. I'm just picking out a small number of things. One more that may seem managerial and not of interest, but I'd suggest to you, when we talk about this in a couple of years' time, will seem to you, as it does to me today, to be really, really important. Many of our services currently operate on the basis of no matter how many patients we look after, we receive the same amount of money. That isn't true if you run a GP practice. It's not true if you run a physical health and acute hospital. But it is true of community-based health services, and it is predominantly true of mental health services. And when we think about the remarkable improvements in productivity that we've seen in this organisation over the last year, I've seen one data analysis suggests a 19% growth in the volume of patients that we're looking after. I suspect that's an overestimate, but even if it was half right, we've seen a really big shift due to your hard work and your innovation. It's surely right that as we look forward to the funding model of the NHS, that our services and the patients we work with and look after are able to have access to that kind of financial growth. There's no new money, so this is about how that money is divided up, but it surely ought to relate to the volume of care we are able to produce, as well as the Secretary of State has said, linking funding very directly to patient feedback, something that couldn't be more important to the board of this organisation. So look, I've talked about short-term fund with the AMM. I've talked about, I guess, long-term gratification and the opportunities of the 10-year plan. And there's just one other thing I wanted to draw your attention to. Huge amounts of work have gone in over the last few months to the peer review work of our inpatient wards, to the culture of care work of our inpatient wards, to the work with the CQC when they visited us a few weeks ago. There were lots of indications of significant progress, with an honesty about the work that we still have got to do. I want to draw your attention on the screen to the prohibited items that we have across our ward environments. Why am I doing that? Well, I'm doing it because if you work in one of those ward environments and you yourself don't know why something is prohibited, I want you to pop off an email to the chief nurse and ask him to explain it to you. He knows I'm doing this advertorial, by the way. But equally, I want you to be able to pay attention to these prohibited items. If it says no blue tack, that doesn't mean white tack's okay. We've got some work to do to make sure when we're supporting people to go on home leave, when we're welcoming carers into our wards, that we don't lose sight of these proper protections that we have as an organisation. So this isn't about lockdown, but it is about vigilance. And so do take a look at the details on the screen and just ask yourself within team meetings, within handover, are we really on top of these situations? I probably wouldn't be saying it on the vlog if I didn't have a mite of concern myself about some of what I've seen when I've done out of hours visits over the last little while. Let me end where I began. I hope we're going to have sun a week on Saturday. I hope the sun between now and a week on Saturday is not too overwhelming. Do take chance to hydrate yourself, but we are looking forward to see you with water, with abseil, with the Children's AMM, and with more Distinguished Service Awards on Saturday, the 19th of July. Thanks ever so much for listening to me. Cheers.